to this computer. All right, good morning and welcome to Caregiving Cafe, everyone. We're delighted to see you here today. Today we are going to hear from John Brown from Oasis and from Kim Pyle with SIS, Senior.
Industry services.
Sorry, yeah, thank you. It's still before noon, so my brain isn't fully awake. So, yes, and we're going to hear about some new technologies and ways that we can, that family caregivers can use to make caregiving a little bit smoother, actually, probably a lot smoother and easier, and to better stay on top of things. So, I'm going to make you the host right now. Make host. Okay. All right. Okay. Hopefully that was not very painful. So, John, would you like to tell us about yourself and Oasis?
Yeah, so good morning, everybody. Let me get this set up. All right, can you see the Oasis screen?
Yes.
Okay, so yeah, thank you, Caregiving Cafe and Lynn, for having us today. I've been working in the senior living space since 2016. And I just kind of want to give you a quick overview of Oasis, what we do. And Oasis kind of led to a new website called Senior Industry Services. And that led to us bringing on this new care companion service. And that's what Kim's going to go over. So I'll turn it over to Kim in a little bit. But just to give you a little overview about Oasis Senior Advisors. So Oasis Senior Advisors of Central Texas is your trusted partner for navigating the complex journey of senior living and senior care. Our advisors provide free, personalized, compassionate guidance to families using our proprietary software and our five-step approach. We simplify the process of finding the perfect senior living or care, ensuring that your loved ones thrive in a safe and supporting environment. We're local here in Central Texas. Our services are free, they're unbiased based on each individual's care. We help find the right senior living between, New Braunfels and Waco. Um, our advisors have a deep knowledge of local senior living options, including assisted living, memory care, care homes, independent living, and all the different types of rehab. We are founded on compassion, using our Oasis IQ software to match seniors and their families with communities and the proper resources. We are focused on making sure that the seniors have the lifestyle, the health, and the financial uh, resources that they need. All advisors bring a firsthand caregiver experience. All of my advisors have either been in a caregiver or they are a caregiver. And they've each kind of endured their own journey. So starting with myself, my mother was diagnosed with dementia. She lived with us. We were taking care of her, doing the best we could. The neurologist said, "Hey, it's time." Um, we didn't understand. A lot of families don't understand the complexity of Alzheimer's and dementia. And just because mom has a good day today doesn't mean tomorrow is going to be a good day. And one day she put the TV dinner in the toaster oven and burned her casita. And we landed up on a path of figuring out Medicare, Medicaid, VA, finding senior living, all those kind of things. Um, it's a long and complicated journey, as you know, when you're dealing with your loved one, and it also is very emotional because it's someone you care about, and so there's always a little bit of doubt. Did you do the right thing and things like that? I will say this, that my mother had 6 good years in an assisted living type A, another 2 good years in an assisted living type B, and then ultimately she landed up in a skilled nursing environment for about a year and a half. It was a difficult and complex journey, but luckily I had enough knowledge and enough resources and able to navigate her complex medical conditions. On my team is Debbie. Debbie has been a caregiver and family advocate for her family with her brother that has complex medical. She's worked in hospice, home care, assisted living, so she has a wealth of knowledge. Matthew has hospital administration education, also working with his family. He's got grandparents in the Temple area that he's helping as they age and dealing with the complexity of the aging process. Sorry, my screen is covered here. Let me move up. Um, who's next on that screen? Oh, sorry, go back. I'm trying to think. I think it's Greg. Greg has
Greg
helped his.
Hanley. Mhm.
Who is it?
Greg Hanley.
Yeah. So Greg has helped thousands of families in Central Texas, navigate their situation. He is also helped his mother-in-law and his father with complex medical conditions. Um, so he's got a wealth of experience along with many years of retail pharmacy. Um, Robin helped her mother, again with dementia as she moved through the process, first with family support, then to an assisted living. Ultimately, they ended up, due to her situation, in a skilled nursing or nursing home environment. Emily herself dealt with her mother. Her mother's currently in a memory care, enduring her journey, and she has a wealth of experience. Annie has worked in skilled nursing, and she is enduring that process with her mother, who was a nurse, who are taking care of their grandmother down in the valley, and also, now having to deal with being a caregiver and struggling through that journey. So we've all been in that situation, but we're also experts in what's going on in the senior industry here in Central Texas. Um, so caregiving is emotional, it's physically and mentally demanding. Um, we understand what it's like. We know your feet when they hit the bed and they hit the floor in the morning, are going a mile a minute. We understand that you've got a lot going on, as Emma was saying, you're juggling so much. You want to make sure your loved one's eating, you want to make sure that you're taking care of the laundry, you got to schedule doctor's appointments, pick up groceries. We know we've been through it all of ourselves. And we also understand the financial burdens it creates. So in Texas, there are 1 million caregivers that are unpaid, which, according to the estimates, is about $2 billion annually in unpaid caregiver work. And that is valued at about $33 billion that it's impacting the economy. So, caregiving for a loved one is not only emotional, it's financially very, it impacts the entire financial industry and the state. Um, I think one other statistic I saw was the average person who needs care spends in Central Texas, in the Austin area and surrounding, approximately $6,700 a month when they start bringing in care. So when that caregiver, is exhausted and they're bringing in caregivers, the average price is about $6,700 a month that they spend on caregiver support. And then when someone needs care, another statistic is that when someone needs physical care, they usually spend somewhere between 172 and $360,000 over their life on the cost of care. It is expensive, and that cost could be twofold. It could be from their retirement, it could be in their monthly cost, or it could be in the negative impact it has on their ability to earn income. So caregiving is expensive, and taking care of the ones that we love is expensive, and it has multiple different ways that it impacts the family. Um, Common struggles for caregivers is navigating the complex care options, understanding the financial options, finding resources, and that's really what Oasis is here to help with. We help find the perfect like memory, like we had a testimonial from a lady who helped her find the perfect memory care for her mom, easing her during a very anxious time in her life. Um, so that's kind of what we're here to do. Um, Sorry, I kind of got off track on my screens. Uh,
Okay.
Again, we're here to help caregivers when they need that help. What makes our system unique, again, is it is privacy protected, it is confidential. Everything is unique to the senior's individual needs. We, you know, match you with communities and resources, hold your hand on that journey. And if need be for senior living, we tour with the family and try to take all that burden off the family. Again, we're not an internet lead generator. We're actually advisors here locally in Central Texas helping the family. Um, why choose Oasis? Again, we're local experts. We have extensive knowledge on the Texas communities from New Braunfels to Waco. We tailor our match using our IQ system to make sure that we're finding the right communities at the right budget for everybody. And we're hands-on support. Advisors accompany families with tours, ask critical questions, follow up post transitions. We just want to be there to help a family on this journey. So that's Oasis. That's what we do. We help families find the right senior living and the right senior care. And that kind of grew into senior industry services. It started out as a networking group, but it grew into a website. This website has a lot of blog content for seniors, specifically in Central Texas. It's written by a local author. Her name is Lauren. She works for me, Lauren Bartling. So really tailored for seniors in the Central Texas area. And she puts out a blog every single week. And so love for you guys to read that and share that information. Um, we also have, and you'll see the example of a blog content. She just put up 10 thoughtful Mother's Day ideas for seniors. Um, we also have on that website a list of resources for seniors. So it has long-term care planning, it's got Medicare, medical care, non-medical care, it's got products and senior care services. So if you're looking for resources, it's a great place to go. That led us to creating what's called a resource guide. So this is a one-page front and back listing of all types of resources. So home care, home health, hospice, adult daycares, nonprofits, support groups, skilled nursing facilities, hospitals, they're all listed on it. So if you need a copy, you can just give us a shout or an email. You can go to the website, you can do it there, or you can just email Kim or myself. Um, and now I get to talk about Kim, and Kim is also a caregiver. She's looking out for her parents as they're going through the aging process. And she has also been a caregiver for other families in the Central Texas area. I find her to be extremely compassionate, and she's helping us launch what's called the SIS 24/7, and we just say Care Companion. And so I'm going to turn it over to Kim. Lynn, if you could make her the host. She has a presentation about this exciting new technology. It is really transforming how you give care, how the caregiver can support their loved one.
All right. Thank you so much, John. Would you mind going? Because I don't know if I can do that from here to make her. Can you go to her little screen where you see, and there should be some little three little dots. Let me see if I can do it.
I may be able to share my screen without being the
Yeah,
host.
you want to try it, and
Yeah.
if not, we'll try. Go
Okay.
into the three little dots and John can make you the host since he's the host.
Oh, I have to request. Okay, I just sent a
Yeah, so
request.
you request. Yeah.
Got it.
Hello. You've been allowed.
Okay, cool.
Thank you so much.
Let's see. Hmm.
Oh, and I meant to ask, is it possible for either of you to put in the chat the website for the link for Oasis and for SIS.
Yes, ma'am. I'll do
Everybody
that
to
in just a
click
minute.
on. Thank you.
Awesome. Hi, everyone. Thank you, Lynn, for inviting us. Thank you, John, for the introduction. And hi to Nancy, Yvette, and Hema. My name is Kim Pyle, and I met John through my parents when they were looking for independent living. And so I got to know John as he was setting up tours for us, working hard, coordinating meet and greets. And so we went on a number of different tours around the city, and it was great. I mean, and I was just amazed the whole time by how responsive John was and how knowledgeable, and that the service was free, is complimentary. I was just, yeah, it was like, it kind of blew my mind. I didn't know that services like that were available, because I too was feeling overwhelmed and, just trying to handle financial information, practical information. And I was living with my parents at the time. Um, and, really running up against a lot of my own like limitations, just emotionally and things. And so meeting John was really wonderful. And then, the more we got to talking, he referred me to Age of Central Texas, where we have an office, and it's a local resource. Although John, correct me if it may be statewide, and a vet there could be. I'm interested to find out. You've got me thinking like what national and international resources are available too. Because when I started digging a little bit, I didn't even have to dig very much, but Austin, we're very lucky here. And Age of Central Texas provides loaner resources like wheelchairs, shower seats, canes, walkers. So I set up a client with, a cane after he had knee surgery, and got my dad a new shower seat that was more appropriate for him, taller and fit better. And it's all on a loan basis, which is really, really cool. Anyway, I'm getting off track here, but y'all have got me excited. It's nice to just commune with caregivers and who, know the journey and are interested in learning about new things. And John's team is such a nice group of people. They've really been wonderful. I'm new to the team. I just started early April, so I don't have nearly as much experience, but I did have a little experience in AI, writing for an AI company, before coming on with Senior Industry Services. And, the future is here. AI is everywhere. And, the more I've spent the last month and a half learning about the Care Companion, which is developed through a technology company, local technology company who we are partnering with. And the more I learn about it, the more interested I am, and the more I realize the incredible sophistication and capacity that this tool has as a hybrid support. So it's not designed to take the place of human caregiving, um, a real person, a loved one who's your companion. It is designed to help support caregivers, really, and home care agencies. It was developed with those two in mind specifically, although John thinks, and bravo to him for pioneering this, by the way, and because it is a brand new technology here, although I think they're in a lot of other states, and so it's just new, so people are uncertain about it. But
I
um,
would like to chime in real quick. So
please do. And
the
correct me if
reason,
I'm wrong, please.
yeah, and then I'll let you go. Sorry. But, I came across this technology because I was dealing with somebody who kept discharging from hospitals and rehabs, and actually was blind. And they were just putting him in a car and sending him home via Uber. And he would get home and then he would start struggling. And he would land back up in the hospital, land back up in the rehab. And the fact that he was sight impaired had some very limiting things. And that's how I came across the technology, was to to find something that doesn't have to, you don't have to press it, you don't have to sign on your phone, you don't have to do anything to use it. And it's got the predictive health is probably the most advanced thing I've ever seen. Besides the fact that it'll answer, yes, it'll let us know if there is a fall and you'll get an alert, but it's the predictive health that I find is just amazing. So sorry, Kim, but thank you. I just
Oh,
wanted to kind of give an overview of like why we were even looking for this technology.
yeah. And to be able to find solutions, when you see people in dire circumstances or you see people struggling over a long period of time, it's hugely gratifying just to be able to find a solution. So, what is it? So, the 24/7 Care Companion system it's an audio-based technology. As you see in the picture here, it's set up with its own router and SIM card. It's not a wearable device. It's not meant to take the place of a lifeline, but these three little pods are about the size of an air freshener, and you set them up in the main living spaces where your senior is, usually like bedroom, bathroom, kitchen, or living room. And it responds to sound, to keywords, sounds, phrases, and acoustic noises. And so it's triggered by those sounds and will, um, respond to any health and care related events. So I guess it'd be easier if I just go through the slides. So they're all HIPAA compliant. They go to the cloud. You don't need to activate anything, change the batteries. Nothing is stored on the device. Um, and the AI part of it is the capacity that it is able to analyze an incredible, filter, analyze, and categorize an incredible amount of data. So, um, I think I think when I was being trained, she said they used like 3,000 years worth of audio data or something to help train this tool. But it's incredibly large amount of data sets that can identify patterns, and help predict care. So, and with this system, the information that is collected in the router is sent to a system you'll see on the right of the slide. There's a software system that's like the notification and dashboard for each individual who is being, monitored. So it's an intuitive dashboard. It'll set up notifications, and urgent notifications in the form of alerts are texted, uh, sent via phone call and email to the agency in charge. So if there were a fall, if there were an event that sounded urgent, whether someone is calling for help, it can hear sounds like water boiling in the kitchen, which might set off a smoke alarm, um, excessive coughing, a cardiac event. All of that would trigger an alert that is then sent to the folks behind the scenes, and so it blends this hybrid care with AI data and human interaction, human response. I think I went over some of this, but calls for help, falls, medication errors in management. It can detect infections, early detection of infections, physical and cognitive anomalies. So if someone is expressing a lot of confusion, or is in a very low mood at certain times of the day, this tool will, identify these patterns, so that we're just armed with more information. Um,
I have a question. Sorry,
oh
interruption.
yeah, please
Okay,
do.
when you said that the data is collected and is sent to the agency in charge, quote unquote, um, would that be SIS and then the caregiver, or when does a caregiver get notified?
Yeah. So let me just kind of
Am I
jump
jumping
in
the
here real
gun
quick. Yeah.
here?
No, that's a great
Um,
question. That's an important
yeah.
question.
It's first, it's okay. So it is not recording at all times. Okay. First, it only records when it hears a health event or like a sound that triggers it. And it will only record if it's health related. Okay. So if there's a loud bang and somebody yells touchdown, that's not health related. It doesn't record. It's not recording all the time. It's only listening for health events or health related issues. The information is on a dashboard that we would then, Kim and I would be the people who would get the alert. And then we would reach out, let's just say it was Yvette's father that had fallen. We would get the alert, then we would reach out to Yvette if she said, please call us if there's anything going on with dad. If she's, let's say, out of state, she might say, oh, well, I'm out of state. If anything happens to my dad, please call 911. Then we would call 911 for her dad. And then we would immediately call her and notify her. So we're the ones that are reviewing the data, and we're the ones that are managing that for the family. And then it generates that regular care plan. I know that got a little ahead. Sorry, Kim.
No,
Yeah.
that's okay. Yeah, no, that's all right. Thank you for that. And also a very quick warning. My laptop is fluky and sometimes it just turns itself off. Since you're in charge, hopefully the meeting will continue and then I will log back in. Okay?
Okay.
Just a warning.
Okay. Okay. Sorry, Kim. Go ahead. Somebody had a question. Yes,
Sorry.
Yvette.
Yes. I'm sorry. So you're saying that if I get the router and the 3 pods and everything, I could use it here?
I mean,
Absolutely.
you could. I don't, usually we do it in Central Texas because we go in and install it, but we might be able to explain it to you over the phone, or get the
Uh-huh.
numbers from you. I will have to do a little research on that. Um,
Okay.
a lot of times we deal with the senior here, and
Yeah.
then the loved one is out of state or out of the country. I do have one lady I'm helping that she's currently in Guatemala and her mother is here. So, you know, but I don't know if I could get the unit there to you to use there. But I can definitely find that out.
Okay.
Well,
Yeah, because
Guatemala is right next to El Salvador. So,
Yeah.
if you can do it in one, you might be able to do it in the other.
Well, again, I'm helping a family there, but I didn't do the care companion with them. See,
Right. Okay.
that's what,
okay.
so,
There's a first.
yeah. So, but
Thanks.
I'll definitely research it and I'll let you know.
Okay.
Thank you so much.
All right. All right, Kim, sorry, next slide or
Sorry, Kim.
Yeah, there might be a way. I bet where there's a will, there's a way. I bet we can
there's a
figure out
will. Yeah.
where we wouldn't be, monitoring for you, but a way for you to get the technology. So, okay, moving on. Cool. Gain edge with data-backed intelligence. So, um, basically this tool, the Care Companion, is, the main thing about it, in addition to the services that it comes with, which is, support service, it's helping to monitor and keep, your family member, your patient, if you're, a paid caregiver, or residents in even assisted, independent or assisted living, kind of a higher level of care. Because it is always on. It's able to fill in the gaps when friends, family, and caregivers are not visiting. So it can provide that necessary information to help everybody make decisions. And one thing that some seniors really like about it is they don't have to activate it. They don't have to mess with it. They don't have to go through the frustrations of, logging on, remembering a password, trying to tell it what to do when it's not, working. It's a passive device in that it's really kind of self-contained and self-reliant. So it's responsive. But one of the features is that it's also proactive, which is really interesting. There's kind of nothing like this out there, that I know of. It and in this dashboard that we talked about, you can develop a personalized care plan. So these are little images of snippets of audio recording that might pick up on someone's, confusion, loss of memory. Um, there's also, when there's a positive interaction between, the seniors and caregivers, it can detect, a great match, a positive interaction, and kind of send credit, send acknowledgement to those who are doing a good job. So it can be really helpful for caregivers to just sort of get some nice feedback as well. Um, uh, it does detect care resistance. Some of the main examples of ways that it can be useful are, you know, predicting in addition to the physical issues, like pneumonia and UTIs, it can detect care resistance. So if a senior family member, a loved one is, you know, having trouble with activities of daily living or doesn't want to kind of cooperate for lack of a better word or uh, um, it will recognize those events and that can help you either make decisions. So all of this information is sort of gathered with the intention of helping to make informed decisions and come up with solutions that are tailored to your individual needs. um, so it's really very personalized. And the goal is also to preserve independence, to help residents. Most seniors want to stay in their homes as long as they can, or stay in independent living as long as they can. We want to encourage a high quality of life for our elders, and this tool, the Care Companion, really helps do that. Um, uh, Improved visibility. So these continuous insights that it can offer um, might suggest, hey, you need to, like I have it set up for my parents, for my dad who's 88, and my mom is the main caregiver. And the other day we got an alert that you know, mom mentioned to him that he wasn't taking his medication on time. And so that helped me know, okay, how can I support my mom as she's supporting my dad? And that may be something that she forgets to mention or doesn't think to mention, or we're talking about other things, or she's stressed and overwhelmed. We're moving on to the next obstacle that needs to be, dealt with. So it's just really helpful information. And the whole idea is to kind of get ahead of events before they become critical. Um, yeah, I just mentioned the medication management. So I wish these images were a tiny bit bigger, but it, if you can see, so part of the dashboard screen involves like making recommendations. The technology is that sophisticated. It might say, take the medication at a certain time every day with caregiver supervision. Use a pill box. Set up reminders on your phone. So it can be just a nice supportive kind of idea generator. Um, and then it also provides care trend analysis. So it can go even deeper with insights into health and well-being. So care trend change for this person, Alice, an increase in coughing was detected. And I think this is on another slide, but actually the companion can track states of wellness over 30 days, and longer, I think, but it can do a 30-day look back. So it can predict changes. Well, whether it be health, um, I mean, mood.
Cognitive. Yeah,
Yeah,
cognitive.
exactly. So it can provide insights. Okay, there was a pattern change in coughing showing an increase by 37%. So it gets very technical. Um, And I think, John, you had, another example where someone had COVID and it was caught early.
Yeah. So we
And
had a 90, I think it was a 96-year-old who was living at home. alone still, and had been driving up until till she was like 92. Um, and the the care companion detected coughing, and notified the family that there was a coughing that had recently started. And they said, yeah, we already talked to her caregiver that visits twice a week, and they said, it's just allergies and it's no big deal. Well, within 24 hours, that coughing had increased by 208%. And so we got another alert that said, hey, we think she needs to see her PCP. And so we called the family back and we said, hey, this is now an alert. It's not a notification, it's an alert. It's getting concerning. And we think she needs to see her PCP. The family was hesitant and kind of resistant. But the next day they decided to take her to the PCP. And of course, the first thing they do is we're going to test for flu, strep, pneumonia, all that. And it detected that she had COVID, and the doctor had found that she had COVID. Um, that she had COVID without most of the symptoms. Everybody usually waits for the chills, the aches, the pains, and it caught it early. It caught it early with just the cough. And that's really all she had. So, that's the beauty of this system, is that it's predictive. It can predict UTIs based on patterns. It can predict pneumonia. It can predict changes in cognitive ability. It can predict that, wait a minute, there's something going on with a health event that we need to address. If you're bringing in caregivers into the home, it'll make sure you're getting good analysis and you're getting good caregiver interaction. If you're getting bad caregiver interaction, you're going to get that notice as well. Um, but and even if they're in a senior living, is the care coming in at the right time? Are they there at the right time? So and I'll just give a couple of quick stories. We had somebody that had moved into an assisted living, and the assisted living contacted us. Nothing was going right. Everything was going wrong. The family was upset. The community was frustrated. So we put it in. And immediately within a couple of days, what we found out was, number one, the family said that mom had no cognitive impairment, and that she just needed care between the hours of 8 and 6, because she slept all night and all that. Well, upon putting in the care companion, we come across mom's waking up at 5:30 in the morning. She's very weak. She's very disoriented. She's having a tendency to try to get out of bed. She falls multiple times trying to get out of bed. And then a couple of times she's had some accidents trying to get out of bed to get to the bathroom. The first thing we do when we wake up, right? Got to go to the bathroom. And so then the caregiver's not coming in until 8 o'clock at the direction of the family, right? And so by the time they get in, she's already upset, she's flustered, she's angry, and the whole day has gone bad. So by putting in the care companion, we immediately came up with a couple of suggestions. Number one, caregiver is to go in at between 5 and 5:30, make sure she's up, make sure she's okay, make sure she gets to the bathroom. And that's really when she started her day, and she wanted coffee and she wanted to get up. So let's get to her schedule, not the schedule of what the family was saying. Number two, the family was very hesitant for night checks. And the community had really wanted to do 24-hour night checks. And most communities do them every 1 or 2 hours. But they had refused those. So we asked them to please consider them of doing it. And so the agreement was, starting at 6 o'clock, they do the night checks. Also, there was some signs with this scenario where she was showing some suicidal tendencies. She had recently lost her husband, and so she was depressed. And so we asked the family to start calling every night around 6 o'clock, give her some love, tell them about the day, and then immediately have the caregiver come in for that first night check. And by doing these things, her experience, settled down. The community and her and the family all got on the same page, and she started to have a great experience. And she did actually enjoy living in the assisted living, but we had to get the care aligned with her routine, not what the family thought. That's one example. Another example we had was a family called and said that they had a loved one living in an independent living. They thought might need assisted living, but they didn't really know the care. So we put it in, and immediately we start coming across, well, he's got someone helping him with dressing and bathing that they weren't aware of. We have we immediately started getting alerts that they felt he had a UTI, which he did, and the friends were cleaning up multiple urinary issues. The caregiver kind of girlfriend or friend. Um, we detected lower body weakness, that he needed more physical therapy and he was struggling with his mobility. And we detected that he had a little bit of a decline in his cognitive situation and he was starting to show some signs of sundowning. So whenever his caregiver or friends would leave and leave him in his apartment, his anxiety would go quite high, right? And so able to start putting all this together to put the care around him that was designed for him. Lastly, a wound was detected, that he had a wound that he was hiding from friends and his family. So again, the goal of this is not to interfere in people's lives. It's not to record every conversation. It's to optimize the care and get ahead of the care, right? Would you rather get a phone call that I think dad has a UTI, or would you rather get a phone call, we're taking dad to the hospital, and now you're dealing with those throws. So it's all about the predictive health. Yes, it has the reactive health. Like if somebody were to fall, we would get an alert. We'd notify the family. If somebody called EMS or if they were screaming there was a fire, yes, we'll get those alerts and we'll definitely let the family know. But the beauty of it is the predictive health that it can do to help the family get ahead of the care before it becomes a crisis.
Mhm. Yeah.
Excellent. And I'm sorry, I have to just to clarify. Thank you for that, John. Amazing, amazing. So when there's a notification, I'm going to call it a notification, but it could escalate to an alert. That's in a timely manner, right? It's not. It's like if you see something today that needs attention, then you would let the caregiver know that
Yes,
day,
yes,
maybe, because 30 days from now is too late. That's no good,
right. Well, a
especially
notification
with a
could be
cough that you said, for example.
right,
I mean,
right, right.
that was soon after it was heard, right?
Usually within an hour is what the
Okay,
research
okay,
has
yeah, yeah,
shown.
yeah, yeah.
And I can tell you, John is on
Yeah.
it.
No,
So the
I know, I
notification,
know, I know, but I just wanted to in my head because
Yeah.
you
No,
know
that's a really important question.
time is very important.
right. Well, a
With alerts.
notification, sorry to interrupt, but a notification is just to let us know, okay, there's something going on.
Right.
Okay. Maybe it's something that need to be addressed. Maybe it doesn't. Maybe the family already knows. Like I had one family, and I had one lady that called and she goes, look, I'm really struggling with my aunt. I need something. So we put it in. Immediately we started getting alerts. She's got a UTI. She's got a severe UTI. It's not good, kind of thing. And, with you get a notification first that hey, we think, but then when you start seeing data that says okay, this is serious, then it's an alert.
Right,
Okay, and that alert then is when we're picking up the phone and calling.
right.
Again, somebody who is just saying maybe showing signs of a little bit of decline in their cognitive ability, that's going to be a notification unless, okay, they're wandering, they're showing aggression, they're showing anger. That's an alert, right? So it just depends on where it's at between notification and alert.
All right. Thank you.
You bet.
Yeah.
I hope that answered the question.
Yeah.
But for more urgent, if someone were to fall, usually it would be within an hour is a, normal time range, definitely the same day.
Yeah.
But
Okay.
yeah.
And just say we have about 5 more minutes.
Okay, cool. I'm gonna slide. Yeah, John gave lots of, really true to life examples. So, I guess the only thing I would emphasize on top of those is you can see how these slides are laid out and they're organized, they're easy to read, they, provide clear action advice that you can act upon. So that's another benefit for someone like me who has, scribbled out notes in 5 different journals and, may not be able to. It is really nice to have a software system that keeps everything organized and very legible. And that can be a huge benefit to the family. Um, action, impact. Yep. Aging in place maintained, hospitalization prevented, addressing cognitive changes. And so we talked about some of those as well. This was the
Yeah, I
30
mean,
days.
you were going to wrap up here. I was going to just interject real quick. One thing is, and I know, Lynn, you know who Teepa Snow is.
Yeah.
And she is a world-renowned dementia expert, and she is on the board with this company as well, really working to help it predict when there is cognitive changes. Because as you know, dealing with dementia is very complicated and it's a constant changing dynamic. And so Teepa Snow's on the board, and she's a global, as it says, global educator. But I wanted to go just one more time over the fact that it is not recording at all times. It's listening for health events. It's listening for specific sounds or loud bangs and things like that. And it goes to a HIPAA compliance where let's just say we got an alert. We think she has a UTI. Let's just give it, or pneumonia. They would send that up to a physician. It's reviewed by, the clinical staff, and then we're notified. And this all happens behind the scenes very quickly. So it is all HIPAA compliant. It is all privacy protected. It is all secured. Nobody's personal stuff is getting out on the cloud. It is all very controlled, and it is all very centered on health care and predictive health, not on what is Lynn and Yvette talking about. Okay.
Mhm.
It's not recording every conversation. It only records if there is a health event or something that's triggering a concern for a health event. And then it only records from that point if they can determine it is health related. So again, somebody loud bang and somebody else touchdown, the system turns off. It's not listening. It has nothing to do with health. But if it hears a loud bang and somebody says help, okay, it's going to record and it's going to listen in to see what's going on. That's going to go to HIPAA compliance. HIPAA compliance is going to listen in real quick. Oh, she's saying she needs help. She's struggling. She can't get up. We've recorded that. We're sending that to John and Kim to notify the family immediately. So that's how it all works.
All
Yeah.
right. Okay. So I always have a ton of questions, and I hope, if you're thinking of anything else, please go ahead and ask. But that's what I was going to ask. Can you just said it would recognize help, or, oh, I dropped something or I cut my finger, and then somebody would be notified and would go to you, and then you would notify the caregiver, and then the caregiver would contact the person. Is that how it would
Correct.
work?
Well, it depends. Every family has it set up different. So
Right.
like
Yeah.
I've had some people that say, I want you to contact the executive director at the community they live in. Some families want us to call, their niece, their daughter.
Hmm.
We set all that up.
Right. Okay.
And then in a couple of cases we've had where the kids are out of state,
Hmm.
they said, if there's an alert, okay, you have our permission to call 911,
Hmm.
and here's his primary care physician. Call his primary care physician. So
Okay.
they ask to be third. So, I
Yes.
mean, we'll set it up however the family wants.
Okay.
We want to support the
Excellent.
family. The
Uh-huh.
goal is to give them the resources, like Kim said, if there's some medication issues. Well, when we're in the throes of caring for somebody, so many things are going on, and you don't see the rhythm, but this system does. So maybe you today were talking to your husband about medication management, and tomorrow he says, "Oh, I forgot to take this," or the next day, I'm really foggy today. Okay, it's putting all that together and say, okay, wait a minute, we've got to address the medication issue. There's an issue. So that's the beauty of it, is that it's always working behind the scenes, looking for where's these gaps? What's going on? Why is it that he's always tired at 2 o'clock after he takes his meds? We think we need to look at his medication. So it's just kind of in the background, kind of checking those things out, just
Okay.
creating that algorithm.
Yeah, it sounds great. Thank you. Anybody else have comments, questions? Yes, don't be shy. Oh, I thought of another one. Sorry. So all this information, I guess somebody, two questions. All this information's available. I guess you have to set up an account maybe, or talk to you so that I can, let's say if I wanted that here, what would I need to do besides calling you? Where do I see the information on my laptop, on my phone? Number
Mhm.
one. Number two, what is the cost?
So, okay, so you can either call Oasis and we'll connect you, or on the SIS website is actually a link and you can put in a request and Kim can meet with you either over the phone or in person to discuss that. The cost is less than $7 a day for 24-hour coverage. It's about $199 a month.
Okay. All right. Thank you.
And that's really what the cost of that is for us to manage it and work it and keep in contact. Because I gotta answer the call at 3 a.m. So somebody has to answer the call. So
Wow. Okay. I hope you're taking turns if you're actually doing that.
we,
I
we we've got it all planned out. We've got it planned out. You'd be surprised. You don't get a lot of calls at 3 a.m. Seniors aren't usually up at 3 a.m, but the alerts are important and we're on them as quickly as
Yes,
possible.
of course.
But
Yes.
yeah. So
And
you're
eventually more people will probably be on the
yeah,
feed.
Mhm.
Uh,
if we get to a certain level, we'll add more staffing to cover it.
Right. Yeah, no, that's very, I think this sounds fantastic. Any comments?
Yvette had a question.
Yes,
Yes,
yes. My dad just fall. I told you it was around 1:30 in the morning. Woke up to go to the bathroom. Took his walker. The walker got stuck on the bed, and he fell and opened
oh,
his head, broke his nose. So there was a pool of blood.
oh,
I
okay.
mean, so in that case, let's say I have the system here. Okay, will it take an hour for me to know that when something is uh, that
That critical, I mean,
he's losing blood?
yeah.
Sorry,
I mean, I
sorry.
don't know if I can't guarantee it's going to be within 15 minutes, okay? I mean, because it's got to go through HIPAA compliance.
Mm.
But the more urgent it is, the faster it's going to move through that system. It may not be, it may not be within 15 minutes, but it may be within an hour. The
but
reason, the
also, if I
reason,
could
go
let
ahead.
me interject here real quick. When I was being trained, the company said that the technology company said we still recommend wearing a life alert so that it's not meant to take the place of a life alert in a critical situation. Yes.
And I mean, and I agree with that, but also the gentleman I told you that lived in an independent living, he
Mhm.
lived in an independent living. He had a life alert. He had it pendant that was provided, but he kept it on his walker and
Mhm.
he fell 4 times in his bathroom.
Mhm.
So the life alert didn't work. So it's one of those, again, it's a cognitive thing. If somebody has a life alert, are they going to remember to keep it on them at all times? Are they going to push the button? Do they
Yeah.
cognitively remember to push the button? And what happens if they are alone? So even if you
Mhm.
have a ready alert, this doesn't get in the way of it, but it's predictive. And so let's just say dad did fall, he couldn't push the button, or he did push the button and he's waiting for a response. You're also going to get a response from us saying, "Hey, let's get a hold of somebody ASAP. He's fallen." So it's just that extra companion care. And a lot of times what we see is we understand how expensive home care is. And like if you're working and you're taking care of somebody, you've got to pay a caregiver to be there or you've got to have a caregiver there. It's just giving you that extra layer of support. And it's cheaper than paying for a caregiver.
Mhm.
So it's much cheaper to give somebody 24-hour support without paying for 24-hour caregivers.
Is your dad
I mean,
okay? Is he
Yes.
okay?
now he's just bruised,
Oh,
and still I have to take him next week to the doctor to see what's.
And that's why you're staying with him through June or July, you said? Is that right?
Well, no, I live in my home with my house, and they live in their house. So my sister that lives with them, I mean, everybody left. Everybody came, like my sister. I have two that live in Pennsylvania. So they came with their sons and daughters, whatever. There were like 4 people there. And then all of a sudden, everybody left. And then my sister decides she's going to go stay with his boyfriend. So she's leaving Sunday. And nobody's coming to help me. So at first, I was kind of annoyed because we agreed that if one goes, then another one has to come. Not to leave it for just one person because there are 2 of them. Okay, thank God we
Mother
have.
and dad both needs care. Oh,
They
goodness.
both,
yeah.
both. That's. I mean, my mom I think is worse than my dad, and
Oh,
they get cranky and they get so. This is fantastic. I mean, I never even knew that something like this
Yeah.
could be. It would be amazing. Like, and having sisters there, that's why I said I can get it here, no problem, or I can get it through the email, whatever. I mean, I can be paying you every month, whatever. So that's no problem because like, and my parents are Florida residents, and we're thinking about taking them to Florida, or they were thinking about taking them to Pennsylvania, which is so cold. We're tropical here. So that's kind of cruel for them to take them at 95 where it snows like, no, no, no. So, but my mom broke 2 of her vertebrae just in her back.
oh
So
God.
they couldn't travel. They couldn't travel, and everything for, well, it wasn't my idea for them to leave El Salvador. I didn't want them to leave. They had lived here all their life, and I didn't think that that change was going to be good for them. Not
So,
having people, not having
Yeah.
friends, not having from the community. My dad is the oldest living person from his friend. Okay,
Oh,
imagine that he's been losing and losing and losing people, but
yeah.
he cannot lose my mom, or he's gonna be
yeah,
devastated.
that's their security blanket. That's their security blanket. So I would say this, I think your family needs to have a very deep discussion because when you move a senior, especially one who has just a little bit of cognitive impairment, just, age-related memory loss, you will see what we call transitional decline. They will decline. They will struggle. They will need more care until they get situated. So I think you and your family need, the sisters and brothers need to have a talk about that. Okay, if we're going to move them to Florida, who's going to be there to give them that care? Because they're going to struggle. We go to Pennsylvania, what are we going to do? Because they're going to struggle. Who's there? Who's going to take care of them? I think that's a deep conversation that needs to be had about that.
Yeah.
While I'm
And,
all for making, we help seniors find senior living all the time, but
mm,
we wrap everything around so it is safe and appropriate. And I deal with a lot of families who move their loved ones. I moved dad into an apartment down here, and then all of a sudden they're like, "What's going on? Dad's acting so weird." It's the transitional decline. It is the cognitive impairment. It's going to exasperate and you're going to see some changes. And it can
okay,
be it can be quite shocking. I've had people that said dad was totally independent, doing everything himself, and they move him to an apartment in a different state, and now he's wandering, he's eloping, he's aggressive, and they're like, "What happened?" So we never know, but you need to be prepared for that transitional decline.
thank you for that. Thank you for that, and thank you for recording this because I'm going to share it with them. And well, this part no, but or this part yes. Lynn, are we sharing
Yeah.
this part?
Yeah.
Is this part
I
being recorded?
recorded this part, but I can delete it. Do you want me to send it to you? I can send it to you.
Yeah, well, I
Yeah.
don't know. Yeah, that's okay. The
Yeah.
thing is
Okay.
that I
All right.
wanted to, yeah, I wanted to do another question. can I have
Yeah,
some
of
questions?
course. Yeah.
But I mean,
You want
again,
I can,
thank you.
did you have another question?
Yes,
Yes,
but
okay. Is
not
it very
not
personal? Because I can stop the recording.
yes.
You want to, okay, so let me stop the recording, okay? And then we can talk about anything. So let me see. Stop. Okay. May I have the
Oh, you need
oh
permission back?
thing back?
Yeah.
Yes, please. Thank you.
You have to ask to share or something. Let me